I'm present in the council chambers with Councillor Foxton, Galloway, and Shantz, and Councillor Verbanovich will be joining us shortly. Other members of Regional Council are participating electronically. We're beginning tonight's meetings with Board of Health, which will be followed by a closed council, followed by reconvening then in open council. So I will now ask Regional Clerk Will Short to conduct the roll call.
Thank you, Chair. Chair Redmond.
Present.
Councillor Urbanovic.
Present.
Councillor Jaworski.
Here.
Councillor Clark.
Present.
Councillor Lorentz.
Here.
Councillor Jowett.
Here.
Councillor Erb.
Present.
Councillor Nowak. Councillor Kiefer. Councillor McGarry.
Present.
Councillor Armstrong.
Present.
Councillor Harris. Councillor Shantz.
Present.
Councillor Strickland. Councillor Foxton.
Present.
Councillor Galloway.
Present.
Thank you.
I would like to acknowledge that the land on which we gather today virtually is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. Before we begin, I would like to recognize that International Overdose Awareness Day is Wednesday, April the 31st. There was an event today in Cambridge, and there will be another one next week in Kitchener, hosted by the Waterloo Regional Integrated Drug Strategy to bring people affected by substance abuse or drug overdoses together to share their stories and to offer support. As we lead up to the 31st, we remember those lives lost to drug poisonings and reflect on the impact that this has had on their families, their friends, and on our community. I'd also like to recognize many of the outstanding organizations, too numerous to name, across our community who work tirelessly to move the conversation from stigma to support. I would now ask if there are any declarations of pecuniary interest under the Conflict of Interest Act. Seeing none, I would now ask Dr. Wong for a COVID-19 update presentation, and followed by Jesse Johal giving us a vaccine update. So, Dr. Wong, the floor is yours.
Thank you very much, and good afternoon, councillors. Today I'll be providing, I think, yeah, Kathy's just changing the screen. Perfect. Thank you. So today I will be providing the usual COVID-19 update, as well as a short update on monkeypox. And as Chair Redmond mentioned, Jesse Johal, our acting director for COVID-19, will then be presenting a COVID-19 vaccine update. Next slide, please. So beginning with COVID-19, we continue to be in the seventh wave. There are indications that we've passed our peak, but the decline has been very slow. Our wastewater signals, along with outbreak and hospitalization data, indicate that COVID-19 continues to circulate at an elevated level in our community. BA.5 is the dominant subvariant of COVID-19 and the most transmissible subvariant of Omicron that we have experienced to date. It spreads incredibly easily. Even the original Omicron subvariant was already much more transmissible than previous variants like the Delta variant. This gives you a sense of what it could have been like without the increased population immunity we've gained through vaccination. Next slide, please. With highly transmissible variants like we have now, the goal is less about preventing infection and more about reducing severity. We have the means to do this through vaccination and booster doses. We can expect to see further waves, especially during the upcoming fall and winter season, when we gather more indoors and when respiratory viruses tend to circulate. We can expect that other viruses like influenza and the other seasonal respiratory viruses will also circulate during the fall and winter. So it's important that we continue to make efforts to reduce the impact of successive waves of COVID-19. Our community has much greater levels of immunity against severe outcomes than it did 2 years ago, which has prevented many more hospitalizations and deaths. Vulnerable settings such as long-term care and other healthcare organizations are stronger now as well in infection prevention and control than ever before. However, waves of COVID-19 continue to present significant risks to communities, especially in the context of a fatigued and/or decreased workforce in multiple sectors, not least of which is the healthcare sector. The best strategy for individuals in our community is to get vaccinated and boosted with the recommended number of doses for them, and to add on additional layers of protection when there is an elevated level of COVID-19 circulating. This includes wearing a mask in confined and crowded places, and optimizing indoor air ventilation and/or spending more time outdoors. Next slide, please. Now a brief update about monkeypox. Monkeypox is a rare viral illness that causes symptoms like fever, headache, swollen lymph nodes, and fatigue, followed by a rash or sores. Symptoms generally last 2 to 4 weeks. We have now received lab confirmation of a second case of monkeypox in Waterloo region, a male in his 30s with a close contact outside of the region. The risk to the general public remains low. Monkeypox does not spread easily from person to person. It is transmitted through close, intimate contact with someone who has monkeypox and who is showing symptoms. What people can do to reduce their risk includes avoiding skin-to-skin or close face-to-face contact, such as during sexual contact, with anyone who has symptoms, wearing a mask if you are in close contact with someone with symptoms, and practicing safer sex. There is a limited supply of the vaccine available to persons at high risk, as determined by provincial eligibility criteria. Public Health has been working with multiple community partners who provide services to populations at high risk, and is offering twice-weekly vaccine clinics at 99 Regina and 150 Main by appointment. These appointments are being taken up, and we have appointments booked over the next few weeks. As seen elsewhere, when we start to see cases, we can expect to see more cases, as healthcare workers are actively monitoring for cases and public health units do active case and contact management in order to break chains of transmission. I will provide monthly updates on our local monkeypox situation as relevant. And that is all for my update. And I'd like to pass it now to Jessie Johal for the vaccine update. Thank you.
Thank you, Dr. Wong, and good afternoon, councillors and Madam Chair. I am going to provide a vaccine update verbally today, as there isn't too much information to be presented in a written format. So we continue to offer vaccines at our fixed sites. We have 2, as shared with you previously, at 99 Regina South, as well as 1 at Cambridge location at 30 Christopher Drive. Along with this, we are also having mobile clinic sites in our townships and municipalities and hard-to-reach neighborhoods to promote access. As you know, last month, at the end of July, the province did advance the eligibility to have boosters for 18 years old and over, as well as youth who are 12 to 17 who are compromised. So those are the second booster doses that were released for this population. Thus far, we have given 75,000 doses of this. At the same time, they released the first ever series of doses for the pediatric population that falls in 6 months to under 5. And we had shared that with you, and we continue to offer both appointments and walk-ins, and have offered many different locations for parents and caregivers to receive this vaccination. So far, we have done around 1,700 doses of that. So the vaccination, we'll continue to provide that as a walk-in basis for anyone who's eligible for any dose, and provide different locations throughout the month of August and into September. The ministry also asked us and shared with us the plan for the fall. They're anticipating the release of the bivalent booster doses as well as flu in September, October. And we have started we have a plan in place for that, and also engaging different stakeholders that we have done previously. The ministry is anticipating that there will be a higher demand for this booster dose, just looking at some of the other metrics that we have available in the last few months. And as such, we are planning for different types of mobile clinics, community-focused clinics, as well as mass immunization clinics. So that planning is underway, and we will share details of this along either via emails or through these updates. Just wanted to provide that preface to what the plan is. Thank you.
Thank you very much, Dr. Wong and Jesse, for those updates. Councillor Clark, go ahead.
Thanks. I think this is a question for Dr. Wong. I've been seeing more and more employers, including some major employers, lifting their vaccination requirements. I know our understanding of the effects of vaccination have changed as we've learned more, and also as we've moved through various variants of COVID. And I'm wondering what you can tell us about the efficacy of vaccinations in reducing spread.
Thank you for that question, Councillor Clark. So vaccines from the beginning, since we've had them for COVID, have been very effective and continue to be quite effective at preventing severe outcomes. Before the Omicron era, they were also very effective at preventing infection. Since Omicron, they've been less effective at preventing infection, but they remain very effective against preventing severe outcomes. Now, the key to maintaining a robust defense against severe outcomes is to get the number of booster doses that are recommended for you as well. So with time, there is some reduction in protection, more so for infection than for severe outcomes, but even protection against severe outcomes will decrease. And so that's why, it's really, the recommendation now is really to remain up to date with your recommended doses, as opposed to just saying, just get your 2 doses. So that that strong protection against severe outcomes can remain. I think expect that, for protection against infection, which does get boosted every time you do get a booster, but then goes down a little quicker than protection against severe outcomes. I think we can expect that to decrease over time, and we may need these periodic boosters to keep immunity levels as high as possible. But the current state is that it remains strong, especially if you get as many boosters as is recommended against severe outcomes, even if it cannot prevent infection like it used to.
Thank you.
I see no other questions, and I know that Mr. Petitpierre and Kellyanne Salerno are on. I'm wondering if you could give us an update on the outbreaks in shelters and how we're handling the unhoused, and then I'll go to Councillor Erb.
Thanks for the question, Chair, and through you. Similar to Dr. Wong's presentation, numbers do seem to have plateaued currently. Current cases at each of our shelters do seem to have flatlined. I don't have the data in front of me at the moment. What I can say is that we continue to use our isolation facility for anybody that is testing positive or is symptomatic, and that we do have space there as well to continue to house those individuals. Kellyanne likely has specific numbers if that's of interest.
Thanks, Ryan. Kellyanne, do you have specific numbers?
Yeah, thanks through you, Chair. We currently have one shelter in outbreak, and most of those are resident cases. Ryan is correct. We're looking at sitting about 6 through a COVID isolation facility right now. So we continue to get updates from our shelter partners, but right now those are the numbers as we have them reporting today.
Thank you. Councillor Erb, go ahead.
My question was non-COVID related, so maybe you want to wait until to see if there's any other questions.
I see no others, so go ahead.
Dr. Wong, this whole issue of scarcity of infant Tylenol and some of the anxiety it's creating in the community, my assumption is public health has no involvement in this at all, or maybe could you just give us a bit of a thumbnail sketch of what's involved if public health is at all?
Yes, you're correct, Councillor Erb. We are not involved in the distribution or supply of medications. So, that would be something that would be managed, I believe, by the federal and provincial governments, although I'm not sure exactly who does what, to be honest. But it's those supply chain issues wouldn't be something I would or public health would have really the latest on. We'd probably be getting our information from websites like Health Canada.
Thank you. Thank you.
Thank you. Colleagues, I see no further questions, but before we move into close, I want to take a moment to congratulate and recognize Stephen Van Valkenburg, our Chief of Paramedics Services, on his last Board of Health and Council meeting before his well-deserved retirement. Thank you for turning your camera on, Chief. Paramedics Services have seen many advancements over the past 9 years with the support of Council. Some highlights of Chief Van Valkenburg's tenure include the creation of a 10-year master plan for paramedic services for the region of Waterloo, which was updated in 2019. This comprehensive plan outlines the resourcing, staffing, and station requirements for service based on modeling for and regular monitoring of specific performance indicators. The plan has guided the implementation of 18 ambulance resources added to the deployment plan from 2013 to 2022 to address rising call volumes and population growth. An additional 11 12-hour ambulances are to be added over 2022 2022 and in principle over 2023. Ambulance stations added in Kitchener, Woolwich Township, and Wellesley Township, as well as the new North Division Deployment Headquarters in Woolwich Township. Chief Van Valkenburg also led the service through 3 successful ambulance service reviews with the Ministry of Health. And finally, one of Chief Van Valkenburg's noted achievements has been securing up to $9 million to initiate the Community Paramedicine Program. This non-emergency service has increased access to health and community services while preventing unnecessary 911 calls and emergency department visits, as well as allowing more seniors to stay in their homes while awaiting placement in long-term care. Chief Van Valkenburg, on behalf of the Regional Council, I want to thank you for your excellent and dedicated service to the region of Waterloo and our citizens. Under your leadership, Paramedic Services has modernized and expanded to meet the needs of our growing community. We are grateful for your vision and responsiveness to the new and emerging healthcare needs of the residents of the region of Waterloo, and your commitment to improving their access to health and community services. We have truly enjoyed working with you, and you will be greatly missed, as we wish you all the best in retirement. And Chief Van Valkenburg, I'm sure you're going to hate this, but this is the time in the program. If you would like to say a few words, you should feel free to.
Thank you, Chair Redmond. And you certainly know me well. This is not my comfort zone, but thank you very much for those kind words. And thank you to all council for the support that you've shown to Paramedic Services over the 9 years that I've been here. Your support has been unwavering. It's been a pleasure educating folks and discussing the issues as we went through this process together. It does take a team to do this, and it takes a village of a team to do this. So this is not all on me. I have a great team that supports me over here in Paramedic Services, and they'll be able to suit you quite well moving into the future. And with the additions that you've approved for us, that places us well to go on into the future. And we look forward to serving the public more, and we look more forward to what the government's going to bring in terms of expanding that community paramedic program into the futures with the new 911 models of care as well. So thank you very much. Give yourselves a round of applause for elevating the service to where it could be and it should be. Thank you.
Thank you very much, Chief. I think everybody's applauding silently in the chamber. Again, thank you for your dedication and your vision and leadership.
Thank
Colleagues,
you.
I would now entertain a motion to go into closed. If I could have a mover and a seconder. Moved by Councillor Galloway, seconded by Councillor Shantz. Please use your icons to vote. That is carried, colleagues. And I now need a motion to adjourn. If I could have a mover and a moved by Councillor Foxton, seconded by Councillor Armstrong. Please use your icons to vote. So that is carried, colleagues. So we will be in closed council on the same Zoom link